welcome to our latest edition of Facebook Live. I'm your host, Jennifer Williams. It's October, which means it's Breast Cancer Awareness Month, and we are here to remind you, if you're over the age of 40, it's time to schedule that mammogram. This is your reminder. We will be putting that link in our comments throughout the course of our program today, and we are so glad and honored to have the one and only Dr. Michele Blackwood, Medical Director of Breast Services for the Northern Region of RWJBarnabas Health and Chief of Breast Surgery at Rutgers Cancer Institute. We'll be discussing everything from screenings to treatment, so if you have a question or if you just want to show Dr. Blackwood a little bit of love, please leave us a comment below. I'm already flubbing my words, Dr. Blackwood. So,
you never flub, Jennifer.
Please help me welcome Dr. Michele Blackwood. Thanks for being here today.
Oh, Jennifer, thank you so much for having me. And thank you to all of our patients out there and family and friends who are joining us.
Yes.
October is a very important month for us.
It is, and so again, we're gonna, right off the bat, rwjbh.org/mammo. It's right there in the comments. We'll pin it. We'll do all the things. This is, if you're 40, if you haven't gotten it yet and you're like, oh wait, I have to schedule it, we're here to tell you. We've got that link for you. So let's get right into it. Just tell us a little bit about yourself and the work that you do here.
Well, thanks for having me. I am the Chief of Breast Surgery, and I basically take care of patients with breast cancer and patients who are high risk for breast cancer. And I operate on them, and I call myself the quarterback of their team, because it really is a team or a village that takes care of each breast cancer patient. So we have wonderful people here and a great team, and we work together to hopefully provide the best breast cancer care that you can have as an individual basis.
Yeah, and they are a great team. I can attest to that. So let's just get right in here. Annual checkups, self-checks, mammograms. Why are these so important? What should we be doing?
Well, think about it. If you don't look for something, you won't find it until it's too late. In breast cancer, like many cancers, it really does help to try and find cancers at an earlier stage. A lot of breast cancers are found by mammogram, ultrasound, or MRI, or all three. And if they're found before you can feel them or before you know they're there, it is a much easier path towards a cure. And we do start to use that word nowadays with breast cancer, which is very nice. But it's hard for patients to believe that mammograms are the be-all and the end-all. And by the way, they're not. Mammograms are just the beginning. They are a screen. If you don't feel anything, or even if you do feel something, we call that a diagnostic mammogram. A diagnostic mammogram is still a mammogram, but the radiologist is reading it real time. So mammograms are the beginning, not the end.
Just the start of the puzzle. And when should we be starting?
That's a really good question. We still stick to our story around here that at age 40 and above, women should be getting yearly mammograms. Having said that, we are seeing a lot more young women with breast cancer. And by the way, this predates COVID. It's not because of COVID. It's not because of the vaccine. This trend has been happening for about 10 to 11 years now. And by young women, we mean women under the age of 40. So how do we detect breast cancer in that group? Well, one is, if you have a strong family history of breast cancer, a mother, sister, even aunt or grandmother with what we call premenopausal breast cancer, you should start screening maybe before you're 40. I always try and help patients figure out if they should be screened. It doesn't mean having a mammogram every year at age 20 or anything like that. But we do have patients who have a gene mutation. We know patients whose mother might have had breast cancer at 30 or 35 years old. They should start some sort of screening about 10 years prior to that. So you take the youngest family member and start it 10 years earlier. Now, if it's before age 25, a lot of times we do ultrasounds, MRIs, and physical exams. We also, as you know, have something new called contrast-enhanced mammography. Really interesting type of mammogram. It requires an IV where you get IV contrast and then you get a mammogram. It is meant to be more in-depth, more in detail than just a regular mammogram. So as many of you know who have had breast MRIs use contrast, that's gadolinium. But some patients can't have MRIs of the breast for multiple reasons, one of which is they may have a pacemaker, so they can't have it. They may have an allergy to gadolinium, which is the contrast. There might be other things that get in the way of us being able to do an MRI. I do say that patients, when they go see their gynecologist, should talk about their risk factors. So obviously, family history always comes to mind, like we just discussed. However, there are other risk factors, like if you've had a breast biopsy, or you've grown breast lumps at an early age, or you've had a biopsy that showed high risk, or that it was at an early age. So there are other reasons. The other thing is dense breast tissue, and you won't know if you have dense breast tissue until you have taken a mammogram. And by the way, anywhere from 25 to 50% of the women in New Jersey have dense breasts. So mammograms aren't the only test for them. We add ultrasounds and MRIs for those patients.
And we're going to get into some of those things that Dr. Blackwood discussed in a little more depth in a little bit later, but can you tell us a little bit too about our breast cancer risk reduction program?
Yes, we started a breast cancer risk reduction program about 10 years ago, Jennifer, as you know, and it's been very successful and very helpful. And what we found is that if we are taking care of patients, say in their 20s or mid-20s, early 20s, and they had an abnormal biopsy, not cancer, but an abnormal biopsy, or they had a strong family history, especially premenopausal breast cancer, or we found some other issues like they've been exposed to medical radiation or radiation, particularly at a young age, then we'd like those patients to be in our breast program. And by that, I mean they see one of us or our PAs, and they have a mammogram, ultrasound, and or MRI, individually figured out by the doctor or PA that's seeing them. We do that before they come in, and then they come in for their breast exam. Then, depending if everything's fine, they have a breast exam with their gynecologist or internist 6 months later, and then they come back around to see us. And this way we're keeping track of them. And what we have found is, I've been here long enough now, that I am seeing those patients come in with very early stage breast cancer that we have caught because they've been enrolled in our program. And that is such a rewarding thing to find breast cancer at stage 0 or stage 1, and these women are gonna be fine. And they're not surprised they got breast cancer at 35 or 36 or 38, but the beauty of it is that it wouldn't have been found for probably another 10 years if they hadn't been enrolled in our program.
Taking those measures,
We also can prevent breast cancer sometimes. So we can prevent it either with a pill, or we can prevent it with surgery. So those discussions need to be carried out in our high-risk population.
Is there anything, speaking of like preventative measures, you know, exercise, eating healthy, vitamins, does that help prevent breast cancer? Can it help reduce our risk of breast cancer?
Well, as a doctor, I have to tell you yes. However, we don't have a lot of, I mean, don't we all want to eat healthy, exercise? I mean, that's the one thing that doctors tell us all the time. The problem with that is we don't know that there's a direct correlation. There are definitely patterns of behavior that can increase your risk of breast cancer, such as smoking. Smoking cigarettes definitely increases one's risk of breast cancer. Patients don't seem to know that. Alcohol use, regular alcohol use, has definitely been linked to many different types of cancers at this point. So if one can limit their alcohol use, we find that is better. The question is, how much is too much? How much is allowed? We don't really know the answer to that. We try and tell patients if they're going to drink wine, limit it to 2 to 3 days a week. If it's hard alcohol, you know, same thing, 2 to 3 days a week with 1 ounce pours.
Moderation, everything in moderation.
Just live like our grandmothers lived and we'll do better.
And I want to go a little bit more into dense breast, because as you said, it's so common. I know people tend to hear it and immediately like, oh my gosh, does this mean I'm at higher risk of breast cancer? So if someone is told that they have dense breasts, what does that mean?
So dense breasts do not necessarily mean breast cancer, does not necessarily mean you're going to get breast cancer. It means that the elements of the breast tissue are hard to penetrate with the mammogram beam of light, if you will. So that's why we add ultrasounds, which are just a sound wave, there's no radiation to it whatsoever, or we add MRIs. Nowadays, we can also add this contrast enhanced mammography, and we're trying to figure out exactly who should be getting those And it's a technology that we now have at the ACC in Livingston, and we're trying to evolve to see who should be getting that every year.
Just like another tool in our arsenal here to help, fight breast cancer, prevent breast cancer.
Sure.
And I know we touched on too, we have heard a lot that younger women are being diagnosed. Is there any advice that you have, to young women? Obviously you can't stop things from happening, but what should they be doing? What steps and things should younger women be aware of?
Well, I think the scary part is that there are no set guidelines yet. And I don't want to profess that we know we have all the answers. We are working on it in the medical world, in the breast cancer world. I would say if you fall into any of those categories of high risk, you definitely should seek guidance from a breast cancer surgeon practice, somebody who looks at all these kind of imaging and can tell you how to maybe help prevent it or how to follow up with us. I think the other thing is that we all know that if we're washing our hands and we find a little nodule on our skin, or we feel something new on our fingers, or we get our manicure done and you can see something on your fingernails, that they might want to get someone to look at it. The same is true of breasts. We used to try and teach breast exam monthly, but quite frankly, that didn't help women find breast cancer at an earlier age or earlier stage. So we ask people to try and get to know their breast tissue. Look at differences. If you find bloody nipple discharge, if you feel a lump that you didn't feel before, if you think that something has changed about your breast tissue, if you're raising your arm up in the shower and you go to shave your arms and you feel anything under there, or you feel something in the breast, or you're soaping up, get it checked out. Don't be fearful of it. It's better to see their doctor than not. Make sure, maybe it's just a cyst and it was just because you were about to get your period.
It's always, doctors always say, like, your body, you know if something is wrong, and don't be scared, because I know people to be like, I'm scared, I don't want to, what if it's something bad? Just get, there's a great team, and that's a good transition for me. You said that you were the quarterback of the team, which I completely agree with. So tell us about this multidisciplinary approach we provide. Who are the other members of this amazing team that we have?
So Jennifer, as you know, we're opening up this beautiful Rutgers Cancer Center that's to my left in the back here. And it will house radiation oncology, medical oncology, genetics. It will have cooking classes. It will teach people how to eat healthfully. I probably should take the cooking classes. But
back to that healthy eating again.
But what we're hoping is that by having all the doctors that take care of these patients in one building, it makes it easier for the patients to navigate through. We have this phenomenal navigation process here. We have a wonderful nurse navigator. We happen to be lucky with
Shout
ACC.
out
to Woodland. Thank God for Woodland. And she helps our patients try and put together their whole care team. Usually breast cancer is a team of at least 3 to 5 doctors helping to take care of that patient. By being a quarterback, I was kind of being funny, but the reality is that we all work together and we present every case at Breast Cancer Conference. And with the new Cancer Center, we hope to have a multidisciplinary group meet on every patient so that we get a really great care plan for each patient.
What are you most excited about?
I'm most excited about possibly opening up more clinical trials, quite frankly. The new clinical trials that we have, people are a little confused about them. It doesn't mean that you're going to get the good drug, the experimental drug, or a placebo. It really means that we have tailored these medicines that may or may not be out on the market yet, or we've seen them work in other settings, and now we're applying it to these patients. And then the exciting part is that it used to be you had to finish the clinical trial 3 or 4 months. Well, maybe it didn't work for patient A or patient B. So we get an MRI at 6 to 8 weeks, and guess what? If it's working, great, we stay the course. If it's not working, we switch to another medicine. So you don't have to wait it out. And I love that. The other part is we're working with Dr. Serena Chen and her group to make sure that patients can preserve their fertility. If they do get breast cancer in their 20s and 30s and even 40s, and if they want to have children afterwards, we are trying to create a very easy way for them to preserve their eggs, preserve embryos even prior to getting treatment for the breast cancer.
Yeah.
So I love the idea that women might come in for breast cancer at a young age, and then they're gonna move on with a regular, normal, crazy kid-filled life.
They can keep moving forward and have all the best people to do it with them and truly mean that. And you talked about clinical trials. So at RWJBarnabas Health and Rutgers Cancer Institute, it's the state's only, I always mess this up, so I'm really gonna read it, everyone, I apologize. The state's only National Cancer Institute designated comprehensive cancer center. So patients have access to the most advanced screening, treatment options, and you mentioned clinical trials. So tell us how that enhances care for patients, and maybe explain a little bit to those that may not understand what that means.
Sure. So there are not that many NCI designated cancer centers in this country. We are very lucky. Dr. Labudi is the head of it. And it means that we have been approved by National Cancer Institute in Washington, D.C., which is part of NIH, and we receive a grant from them it's a 3-year process, but we get it every year. And what it means is that we have the latest, greatest technologies, doctors, and trials available with the latest, greatest medicines that can take care of many different types of cancer, not just breast. So we are very lucky to have that here in New Jersey, and very, very lucky that it's part of Robert Wood Johnson Barnabas Health. You know, there are some states that don't even have an NCI designated cancer center. So we are the only one in New Jersey.
And we are truly, with the Melchiorre opening, the Jack and Cheryl Moore's Cancer Institute in New Brunswick, the Vogel's openings, you know, in the coming months and years, as we really truly are taking cancer care and reimagining it and bringing and making it accessible for people, and it's really beautiful. And we have all these incredible doctors, and I do a lot of these, and I know I always say it, but I do mean it. They are truly absolutely the best. So I think our program is coming to an end. Is there anything else you'd like to add?
No, Jen, I think this has been a very informative session. I hope for anybody out there, and if you have any questions, please let us know. I would love to help guide you if there's anything more that you need to know.
Yeah, we got to leave us a comment. You can always send us a message. We'll get it right over to Dr. Blackwood and the team. And again, I'm going to tell you, get those mammograms. rwjbh.org/mammo. It's easy enough to remember. If you haven't gotten one yet, or you're due for one, now's the time. Get in there and schedule that. And happy Breast Cancer Awareness Month, and thank you for all you do. I think the world of you, and thank you for taking the time to do this today.
Thank you for all you do and educating everybody.
Thank you.
Thank you.
We
appreciate your energy.
Thank you. We love it. We love it here. Okay, we'll see you next time, everybody. Take care.